I was asking, like, are they aware of what happens after prompting the AI, and do they know how harmful it can be to just putting every information about the patient and whatever they've given to a patient to AI? So we're going to be starting. So we are using two platforms, that is Zoom and X Space. So in case you're answering questions from a given platform, we'll let you know, and please don't feel lost. Yeah, so today we are going to be talking about who owns the prompt, and I'm really glad to welcome you to this session.
Thank you, Kevin. I hope everyone can hear me. Kevin, seems like we have lost you. Brian, I've also invited you to co-host. Kevin, I've also invited you to co-host. So I think you have some admin rights.
It has already started. You have to look at the patient files, you have to check his stock, you have to check if you have enough stock, you have to check for the previous treatments the patient has gotten, you have to work with the doctors to check for the previous medical history, and in all this, there's the way technology comes in, the chatting, because we got all this information from the things we ourselves have entered in the system. Right now, the Ministry of Health in Uganda is doing a whole paper. So you will find most hospitals, including the one that you have entering their the patient information into the system. But as you enter these things into the system, you don't have to write the whole thing. You find yourself summarizing things. To make sure everything is entered in the system. This will help you when the next visit of the patient reaches. You'll be able to trace the things you entered. You'll be able to trace the medication you get. Another example I can give, I really enjoy watching medical routines. This specific thing from the feet that really caught my eye, especially about AI. So the clinicians had a lot on their feet. Chatting is like writing what you have done on a patient. Like for example, I gave an injection at this time. Like everything you've done throughout your shift has to be chatted, and I think you can tell how much work that is. So this clinicians had devoted to an AI tool that would help them, enter this space. But somewhere somehow, the tool got one of the medications wrong, and they had no information of which medication was given. So our hospital day-to-day work, we interact a lot with technology, we interact a lot with the documentation, which is the technology. That's how our typical day is.
Very eye-opening. So that leads me to another question. As you use AI, or as other health workers use AI, do they really mind about the safety, or do they think about a data privacy? For example, in case I'm going to write everything that I've done. For example, I can edit these things and that information. Do they care to mind about maybe when I'm doing this? I need to finish this task. Do they care to maybe remove sensitive information, for example, names, age, etc., and do they care to remove that information for data privacy? Because maybe they are caring about this patient. I was asking, like, are they aware of what happens after prompting the AI, and do they know how harmful it can be to just putting every information about the patient and whatever they've given to a patient to AI?
Thank you, Kevin, for that question. In the healthcare setting, in the most healthcare didn't care about getting their patients right fit, because one of the principles of this start healthcare is confidentiality. So the challenge is that many people have never been trained on what happens when this information is entered into healthcare tools. They live in the next patient rather than thinking about whether the data is best stored. So once it might take a close look at, I need to find something that will save my patient. So they'll end up feeding whichever information they have, and forgetting or not having knowledge of where this information goes. So I don't really think the issue is maybe carelessness. I think there's a gap in awareness. Like most people do not know where data goes. Yeah, that's what I can say about that.
Right, thank you, Suzan. So we are going to explore another side of it, and this question will be to Caleb. So after hearing what Suzan has said, do you mind describing to us as non-techies how and what happens after someone sending a prompt to ChatGPT? So do you mind giving us like what really happens when someone uses a cloud AI, and how it processes and it extracts the prompt and then extracts the prompt and replies to a person who has sent in that prompt?
Hello everyone, good morning. Thank you so much for having me. It's a pleasure to speak to you all. I don't know if I'm audible.
Yes, you are.
Perfect. Yeah, so I can maybe try to explain this briefly. So basically, when you send a prompt with information, maybe asking a question, maybe you want to get something done, that request is sent over to the server. So say you need to the text you put is sent to the edited servers. Equaling the MSP. So if you're using this script that are going to China, if you're using this strong that's going to go to France, if you're using ChatGPT that is going to go to the US, those are their servers are. So once information goes there, it goes to GPUs. So we have these big powerful computers that they use to generate their responses, and then the response is then sent back to you. So yes, the prompt is sent by you, but they store copies of that information, so you can go back to ChatGPT and you log in, and then you see your chats from last month or last year, because they're stored on their side, right? Actually, consumers, we just have to trust the fact that in that sort of service, they will say something like, we don't use the subscription models. But once again, it's a trust thing, because they can essentially do whatever they want, because they have access to that information. So if you're working in a regulated environment, that information is in fact being stored by them. Just in this case, usually okay that information is to train models. So yeah, that's typically how it goes.
Okay, so the other question is, Mjanga is it's a tech company, and one of the products that we have is a file. So, and it's going to be the second. So, how can Mjanga or anyone out there use, because for yes, I know I think that will be in but fintech companies are not allowed to store data or use models outside your country. So whatever you think has to be in your country. Your servers have to be in your country. So for the startups and people on this call, how can they prevent the user, like how can they prevent this, for example, sending data or sending our prompts? For example, if I use GPT data about a question, that means that in that server somewhere they're going to use this information for training their models, and their models are going to be better, but still they have this patient's information. So how can a company in Uganda work? How can it develop something that prevents such kind of crime? That another country or another company out there from having someone's information anyway.
There are a few options. So first of all, I'm not so familiar with some of the policies. I won't speak on them, but some of the options that you do have is you could go the open source model route. So these days you have some very good open source models that you can actually use on your own infrastructure. So when you do that, you can control, because when it comes to ChatGPT, all the likes you have, you run the model on your own hardware, so it's a bit easier that way. But still, again, it depends on your use case, because most of the open source models are also not as strong as the ones that are typically hosted. So it depends on your use case. If your use case can, if an open source model can do options, that's an option. And you can also run them locally, like even on your own computer. If you can small size and it works for you, you can do that. And then you can simply ask as many questions as many calls without having to send your data out. And that is the open source is usually the best option. But then again, it also comes with its own challenges, because hosting your own model is it can be complex, like I said, depending on your use case. If what you're doing requires a large model, then you probably have to host it on a server. So that also depends. Do you have access to a server? Does your organization or your company, does it have access to the hardware that is required? Or can you rent that hardware? And also the cost dynamic of it, because using ChatGPT is essentially free for most things. But now, for your use case, does it make sense to pay the extra money to have your own setup? So it really does depend on those questions. But the open source route is still a viable approach.
Thank you, Khaled. So, Elizabeth, let's bring you into our talk. So, there is a big African Union strategy on AI, but as we've listened to Suzan, there is still a huge gap between high-level policies and then the realities that are happening in our hospitals, clinics, and everything. So how do we actually bridge the gap to protect our patients, our staff, and our communities? Yeah.
Thank you. Thank you everyone for having me today. I'm glad to be part of the discussion. And I agree with everything that Suzan and Khaled have mentioned about AI. And I think one of the issues that we still have in terms of looking at health systems, or just the way healthcare is right in hospitals, where a lot of healthcare workers are not involved in. Let's say if we look at it from a policy perspective, developing policies and other strategies, the people who are actually on the ground doing the work are not involved in developing these policies. And I think a lot of times it comes down to lack of knowledge, or maybe just not knowing what is the right thing to do and what is not supposed to be done. And I think right now what we still struggling with AI is the fact that a lot of people do not know, like everything that Khaled explained. When you put a prompt, what happens, where does your data go, the issues about where they're stored, and the fact that security can be breached. And I think if we can get the people who are involved, like for example the frontline workers, if we can get them involved, we have trainings, we train them, we help them understand what AI is all about, what happens when you put a prompt and you're trying to, for instance, you're trying to write a short report, you're trying to save time, and you're writing a report on ChatGPT, what happens when you put in the data for a patient. If people can understand, I think we can be able to be on the same page. But also, it's very important that we have, like you mentioned, that we do have an AI guideline from the UI, but we still don't have those AI guidelines, or we don't have them included in our high-level policies. And it's even worse when you look at local policies in, for example, countries or districts. We still need to be able to bridge the gap that we have between the regulator gap, like in the gap, where we have technology moving way too fast than our policies. And
right, thank you, Elizabeth. I think you've partly answered another question that I wanted to ask you, and it is how, let me just ask in case you can add on something. So how do we make sure that the AI policies or rules actually help healthcare workers? Because we've seen some sectors. I'm going to give an example of fintech, and mainly in Uganda, there are some policies that are really good, but then they end up limiting more people to enter the fintech space. So how do we ensure that as the policymakers come up with these policies, they are also ensuring that they are not limiting the people? For example, Khaled said that in case you want to really, you really want to own your data, you have to have a server, but servers are expensive, so people end up using the ones that they can easily access. That they can easily access, and these are the ones that we do not have control over. So how do policymakers ensure that whatever policies that they are setting up, they can easily, the people, for example, the developers or the hospitals can easily work with these policies and not limit the entry of people into the health tech space or into health because of the limitations set up by the policies made. Elizabeth, did you hear me?
yes, I appreciate you well. I think it might be my network. But I hear you and then you go quiet and then I'll hear you again. So can you just come again with the question?
Okay, so the question is, how can policymakers ensure that they set up policies, but the policies do not limit the entry of, for example, health startups, tech startups into the industry, or limit hospitals from using tech. Because as I saying, Suzan mentioned that they really need that tech, but then there is that gap. But then how do policymakers ensure that as they set up the policies are not limiting the entry of startups and health industries or companies it doesn't limit the entry.
All right, thank you. I hope you can hear me on your end.
Yes, I can.
So for me, as someone who is also who believes so much into research, I think I would take it back to policymakers making sure that research still comes up, like it's still a priority before development of the policies. Making sure that, for example, in this case, you're saying that sometimes these policies can limit the entry of fintech companies, or it can limit the kind of like to what extent people are able to use this AI if they are owned by for instance, the organization itself. I would encourage, first of all, let's start with research. Why is it doing what's happening in can we do identify the gaps and see what can be done to make sure that maybe we compromise or we find a way to be able to create guidelines that are clear, that still make sure that we're securing the information of whatever, for example, it's patients, whatever information that people might be using or might be entering into AI, but at the same time making sure that we also choose the flexibility. And maybe now that AI is still something that's still, if we can start from research, in that our policies should be laid by research or data. Data should be what gives us the information of what we need to include in our policies and what we shouldn't. And at the same time, I'll still go back to my the first, I think one of the things that I mentioned about making sure that we involve the people who are on the ground in designing these policies. We involve the people who are actually using those policies, so that when you're developing and designing those policies, you get to hear things from their perspective of what exactly things are like on the ground. Because if we want AI policies to be practical, if we want them to be trusted, and if we want them to be sustainable, we need for instance, if I'm still going to keep on referring to healthcare workers, because I think that's my part. If we want, for example, frontline workers to be able to use these AI tools without being limited to what extent they can use them, we still need them to be involved in designing these policies. We need them to understand what it is all about. And then in the time that we're developing those policies or designing those policies, we have our data that tells us this is what is happening, this is what we can do, as we are coming together, people with different experts, some who know exactly what is on the ground, some who knows how to design the policies, and we involve even the people like you mentioned, developers and people who know exactly what we need. For example, what kind of a server are we going to need if we are going to design our own model of AI that is going to give us much information, or is going to allow us to be able to do this and that. And then we see, with the resources available, what can we manage to do? Because I think that's even how most systems are operated. If we look at the health information systems that we have right now, we do have other health information systems that might be expensive, require a lot, and based on how they are prioritized, for instance, if it's in a government institution, based on how they are prioritized, they also determine how much resources will be invested, and also based on what they have. I also think that another thing that we also need to consider as we're doing this, as we're trying to bridge the gap between AI and policies and what can be done, or implementation of different projects, making sure that people are still able to use AI responsibly. We also need to find ways of involving people who might be, in our case, in organizations, we're looking at funders and donors who might be interested to invest in this. Because it's something that needs to be given as much attention as we give to other areas in different projects that we work on. For example, if it's in the healthcare, if it's in the health system, as much as we give attention to, for example, issues about maternal health, and to make sure there's funding involved, to give attention to issues about digitalization of health systems, we also have to consider looking and giving as much attention as we give to this to AI and making sure that people are able to use AI responsibly. Thank you. I hope that answers the question.
Yeah, it answers the question. Thank you so much. That's really, I was not expecting that, but I also love the fact that you mentioned that the people should be involved. Last year I attended an event mainly about the AI policy and governance, but it was so disappointing that among the speakers, the panel and everything, there's no, they didn't invite developers or someone.
One of the things, even before the administration comes in, the healthcare workers need to change their attitude towards the AI tools and technology. As we've seen healthcare advancing, we now have technology-guided operations where it is minimally invasive. The patient has a limited days stay in a hospital, and he'll pass. In the same way, the healthcare workers have taken on this technology operations in giving care. The same way they should adopt to AI. So before even leadership comes in, we as healthcare workers need to change our attitude towards the AI. And when the administration comes in, one, they should be able to provide a few things like train the staff, and also provide the tools that they think are important and secure for their people to use. I think Caleb mentioned that some of them are called, and people resort to using free AI tools like ChatGPT. But then when the administration comes in to purchase tools that are secure, we can be on the safe side. For trainings, they really need to be trained continuously on which information should be shared and which should not be shared. An example I can give, when you're typing in a prompt, maybe you have a patient and you need to know which dosage of medication you're going to give them. It does not necessitate you to also write their name. Yeah, just a simple calculation of what you need is enough. So these trainings, will help the healthcare workers be trained on how to properly use AI tools. Yeah, so mainly from the administration, those things that purchasing tools that are favorable and that can protect the patient's privacy, that can protect patient's data, and also continuous training of their healthcare employees. And then what I mentioned at the start is that we as healthcare workers need to change our attitude towards AI tools. That's still a very big challenge in healthcare. Yes, thank you. I hope I've answered the question.
Yes, you have. Thank you, Suzan. So we'll be going back to Caleb. So Caleb, looking back on what Suzan has said, and as I was introducing you, I mentioned that you worked on the UCCB, and it is the UCCB. So I want to ask you about building. I want you to explain to us why local context, and in this conversation, the whole context is where it was pointing to the hospitals. So when you're building a solution for the hospital, why does it really matter and how does it look like to build an AI tool or an AI model for Africa? For example, an AI model in health for Africa, for African hospitals. So how does it look, and why does local context really matter?
Okay, so first things first, I haven't really worked in healthcare, so I may get a few things off, but in terms of building for context, I think one thing that I think we should know is the fact that these models, the ones that we use, from say OpenAI, Claude, majority of the data they use to train those models is from the Western world. So basically, even the Western healthcare systems. So I'm not sure how many times. I'm sure it's definitely possible to maybe say in a prompt and ask a question about maybe a case and ask for some drug recommendations, and then it recommends a drug that is not really feasible. Maybe it's too expensive. Maybe it's not readily available. So these models sometimes occasionally lack the context of how things work locally. So it may tell you to maybe try this or do this particular scan or do this. Yet the reality on ground is that may not be necessarily feasible given our conditions here. So as someone who's working on these tools, someone who's building these things are things that you have to account for to make sure that your solution can work. So that means you should account for what actually happens. So you have to be in touch as a developer or as someone who's working on a project like that. You have to be in touch with the reality of the situation that's on the ground. So you need to at least understand in our country, these are readily available things. These are things that make sense to recommend based on the reality. So the solution has to be contextualized to the reality that's on the ground situation. So you basically have to account for that. Maybe you would have to store that information, like the best practices or what is usually done, and have that, and the AI system will be able to work with that information, not just relying on the information that was trained on that isn't representative of what's going on. Do you know if that answers your question?
Yes, you have. Thank you, Caleb. And about the local context, last month we had a meetup that was mainly the theme was build with us, not for us. It was mainly about building with the communities and building with the local context. To me, it means that you're building with the people. So in case you would want to listen or to watch the recording of the meetup, you can just check out our YouTube and you'll find the recording there. But it really means a lot because in case you look at this meetup and everything that we've talked about, for me, what really stands out is building with the people, and that would include the local context. Because in case you're building with the people, you'll understand that maybe this information is so sensitive, we should not put it, we should not just paste everything and put it in ChatGPT, because you're building with the people, you care about them, and not willing to share such important information or sensitive information on ChatGPT. Yeah, and yeah, that's a great one, Khalid. So going back to Elizabeth, I have, this is quite a practical question to you, and yeah, so imagine, if you are working in a hospital and you've been part of this conversation, of course, what is one thing that you would tell or you would support your staff with first thing on Monday. So after listening to this conversation, and imagine that you are working in a hospital, maybe a hospital director or clinic manager, something like that. What is the first thing that you would advise your staff or the people you work with to do after listening to this conversation?
Okay, thank you. I think for me, the first thing I would have to take, for example, like you've mentioned, if I was working in a hospital, I think the first thing I would have to, I would make sure that, or maybe have a meeting with everyone and just talk about responsible use of AI. I think awareness is one of the first things that we should focus on. And just helping people to understand what it truly means, like looking at it from a perspective, the way Karibi has explained it, of how when you put a prompt, how far it goes and how such information can be used to train and like to train models, and at the same time also not to rely on information that is not contextualized for us. If I was working in a hospital where people are using AI to, for example, the example this is about using it to maybe there is a prescription or something. I think just knowing how far this goes, what they happen when you put in the prompt, and how trustworthy that information should be or shouldn't is important. So I think the first thing I would focus on is awareness. And maybe just to add would be for us to work together as a team to develop something. It can be a simplified guideline for responsible AI use that we can use and refer, that will help us in that context based on what we're doing and based on what we're trying to get from AI. And then maybe from there we can see how far things can be scaled up. But I think I would start with awareness and just basically having a simple guideline for responsible use of AI.
Right. Thank you so much, Elizabeth. That is so insightful. And I've personally learned a lot from this conversation, and I'm sure that the audience has as well. So we have a few minutes left. So I'm going to let the audience ask a few questions, one or two questions, and then we'll have a closing remarks from the speakers. So, do you have any questions to the speakers, or any suggestions, or you want to add on something we're talking about? Yes, anything.
Thank you very much, Kevin, for hosting the event, and thank you to all of our speakers. We've had a wonderful 54 minutes. Mine is just, I think both a comment and maybe to seek further input from Caleb. The challenge that we have at the moment is that, for example, we talked about the issues of investment, issue of making maybe application, whether to get a cloud service. Most likely we're going to keep cloud service outside the country, probably the US or Europe. If you're having set up your own cloud in your own infrastructure locally, you'll probably take up a very chunk of your budget, and you're still guaranteed on the return on this investment. So we've talked about the aspect of technology moving very fast, and then our policies kind of playing a catch-up role. But I think one fundamental aspect that also needs to be considered, which is the third leg, is the aspect of investment in infrastructure. Policy-wise, I think technically, policy-wise, I think in terms of education and the educational field, a lot of research. I think most of the ministries rely right now on the university to do this kind of research, and this is helping out on the policy aspect to bridge the gap. And of course, I think Kevin, you also talked about the initiative by the African Union. What we need to do a lot more, I think, as the people and in this region is investment in infrastructure. We've relied upon private sectors like MTN and all these other data center providers, but I think government needs to come up to also invest such that the services are affordable to such companies like Mjanga and any other that is coming up.
Thank you so much, Vincent, for that comment. I think I agree with you as well. Government should step up in terms of investment, build that infrastructure that we need to run using one of those locally within the country. There are a few startups, I believe, that are coming up to serve that role, but it's still going to take some time. I think the Screen Cloud that launched not too long ago, and they do have GPUs as well, the ones that are required to run these models. But I agree with you. The police side catches up, so need to get more investment in the infrastructure itself.
Right, thank you. And I also agree to that, because I believe when the government invests in something, it really makes it easy for everyone. And we've seen countries that have done that, whereby their governments have invested in something so that people can also tap into that industry, and it has really helped. So by the government helping with the infrastructure and everything, I think it would be making life easy, and it would be protecting people's data in return also. So do we have any more questions from the audience? Okay, so I think that's all. So to close us out today, I would love a final word from our panel in just 30 seconds. One single key takeaway you want the audience to leave with today. So we start with Suzan.
Thank you all for taking part in this. I think it's a communication. It has been a great session. So much fun. And my closing remark is AI has a great potential to improve healthcare. What I believe that we as healthcare workers you just need to know how to use AI. Which prompts should I use in AI? It's not about not using AI. It's about how properly to use AI. So healthcare workers the right training, clear guidance, and secure tools. I believe this will be able to help them reduce their work burden, especially the administrative part, where they have to chat in, what happened during the day, and basically their activities. So it's just about our mindset. Let's turn our mindset to a positive side, and also learn how to properly use AI. That is all from me. Thank you so much, people.
Thank you, Suzan, and I love the fact that all of us speakers today, we are all part of this conversation is not using AI, but the main goal is to learn how to use AI effectively, as we made about the prompts that we give it. So let's move on to Caleb, your final thought.
My final thought is on awareness. I think it's already been touched on, but basically going the extra mile to even review the terms and conditions, the terms and services of the air that they're using, which is most people skip. But just really what you're getting yourself into, and then also anonymizing data or anonymizing where possible. So if you're in a sensitive environment, you can give out names, try to share as little information as you can to make sure you don't give away too much, but still get the response you're looking for, and just being mindful that this company, as much as they say that they won't do something, that doesn't necessarily mean that they will not do it. So just being cautious and being mindful.
Thank you, Khaled. Yeah, I love the anonymity part, and I really didn't want to go to the side, but I don't know the statistics so well, but they say that few women use AI compared to men, and one of the reasons that they say that women do not use AI, the reasons are first, like, basically, like, why am I giving AI all this information? Like, you know that trust that I cannot just give AI all this information about myself or anyone. So that is why we have less numbers of women using AI. But still, that should not limit us from using AI. We can do incredible things with AI, but let's mind about the anonymity and let us be aware that, just as Caleb has said, these guys are just to not share or to use our data, but you do not know what happens when you're not there. So lastly, let's have a vote from Elizabeth.
Thank you. I think from everything that we've discussed, I've also learned something. And from the look of it, AI does present, like, it's an important, something that gives us an opportunity to advance our systems. It can help us a lot, like Suzan mentioned, it can help reduce other tasks or make our work more efficient. But it still comes down to what Karen said. We need awareness, we need good governance, we need the resources, like you commented, we need investments. And if we can come together, look at it from all angles, I was supposed to look at it as something that is actually influencing the system, not just looking at it as something helpless. And I think if we can come together, do the research, do the work, develop the responsible policies, we have the good governance, we have the right leadership with the investments, AI can actually help us make a lot of difference in Africa. And also not forgetting contextualizing it, making sure that we include information that is actually about us and involving all the right people, like the healthcare workers, the developers, and everyone when we're developing these policies, or making sure that people are aware of what the technology is like. So I think, yeah, AI presents a good opportunity for Africa, for health systems, and for other organizations or companies to need to work at it together and create solutions that are contextualized to us. Thank you.
Thank you, Elizabeth. And from Elizabeth's takeaway, I mainly concentrate on contextualizing AI, and we can only do this by documenting. So Africa will have the problem of not writing down. So you know how in the Western world you can easily get information about something. Of course, there is the data to develop these models or anything, but still they write down everything. So we should also start documenting things and setting up the company, write your story and put it somewhere so that when we are researching about this company or this setup that is about we get information about it, and that is how we are going to contextualize our model by having data, because you can then contextualize the AI models with no data. So we need data, but still mind about the privacy, the data privacy part. So we need data, so we need to document things as Africans so that we can develop better models that really work for our context as Africans. This has been a great session. I've really learned a lot. I didn't expect to really learn a lot, and I believe we've all now understood why we chose the theme, who owns the prompt, and you've understood the theme better. So as we close today, I would advise us to post about what we've learned. You can tag the speakers, you can tag Mjanga Technology, and anyone you're seeing on the call. Tell people about what you've learned. We're going to be posting the recording on YouTube this coming week, and you'll be notified once it's up. In case you want to view something or you learn something, or maybe you forgotten something, you can just go to our YouTube, which is Mjanga Technology, and watch the recording. And also, do not forget, we also have a recording about building with us, not for us, and you can also watch it so that you learn how to build for the African context or for the community that you're building for. Thank you all. Thank you to the speakers. This is Suzan, Caleb, and Elizabeth. We've learned a lot from you, and this meetup couldn't come out this way without you guys. Thank you for your expertise, and continue. I know you're all working on incredible things. Please continue doing that so that for a better Africa, so that Africa gets to be better. And yes, thank you for to join. Thank you so much, and we can't wait to have you in the next meetup. Have a great weekend.
Thank you.